This is a presentation on Oppositional Defiant Disorder, or ODD. This is what ODD usually looks like. Oppositional Defiant Disorder is usually a misunderstood disorder where most people assume the child with ODD is an irreparably hostile individual with no hope of recovery. While children with ODD exhibit negativistic behaviors which disrupt daily life, they suffer as well and require help and patience from adults around them to help them achieve their potential. This is a brief introduction to ODD. What is Oppositional Defiant Disorder? Oppositional Defiant Disorder is defiant behavior which lasts longer than 6 months, with excessive arguing with adults and active disregard for adult authority. Usually children with ODD have a very difficult time following rules set by adults and complying with them. Most of the time, this is a cause for arguments and disruptive behavior. Thus, ODD is a pattern of behavior where a child is hostile, disobedient, and negative in regard to adults and people around them. Defiance is an active disregard of an adult directive in order for the child to feel in control. This is at the heart of ODD. Most children with ODD require control. In other words, they feel so chaotic that they do not know how to regulate what they feel and what is happening around them. So usually their aggressiveness or anger is a way to seek control and to sort of find some kind of calmness and groundness in their life. Characteristics of ODD. The characteristics are split into two, personal and social, because they play off each other a little bit. Children with ODD exhibit personal characteristics which impact how they interact socially with other people. On the personal level, children with ODD often question rules and oftentimes defy those rules. They refuse to comply with those requests and rules. They lose temper very often. They are moody and get angry easily. They have low opinion of themselves and they throw a lot of temper tantrums. This is because most of the time children with ODD have a very hard time regulating what they feel. When that happens, when they act out in such a manner, this affects their social interaction with their peers and people around them. So socially, they tend to blame others for their mistakes. They're spiteful and vindictive. They get annoyed easily. They deliberately annoy others. They have very few friends, which causes them to have trouble communicating effectively their feelings and emotions. Because children with ODD have a hard time communicating their feelings and emotions, usually those feelings come out in anger and in sort of a bundle of confusion. So the spitefulness and vindictiveness is usually associated with the fact that they misunderstand what the person is trying to explain to them. At the same time, the child with ODD is also misunderstood. So this creates a very negative social interaction where both people sort of fall into an argumentative battle where the child with ODD feels increasingly hostile and begins to feel they need to sort of protect themselves and fight against the person because they feel that the person is trying to get them. So they become spiteful and then begin to blame others, thinking that what they do is always right and they themselves never make mistakes. This, of course, is not an indication of bad characters, but rather it's sort of a confusion that children feel. They're confused socially. They can't express how they feel. So whatever goes on in their mind is a bundle of fear and just confused feelings, which need to be regulated better. Disruptive behavior is consistently challenging class rules by refusing to do assignments and arguing with teachers and other students. Aggressiveness toward peers through verbal threats and refusal to calm down. Demands for attention which detract from others and from learning. This behavior causes failure in school, social isolation, stressful classroom environment. Possible causes of ODD. It's important to note that these are causes that are not exact. They are sort of predictive causes. Scientists have not zeroed in exactly on what causes ODD, but these are possibilities. They consist of biological, genetic, and environmental causes. Biological causes center on possible abnormalities of certain brain chemicals or neurotransmitters. Messages delivered by the neurotransmitters might be mixed up or imbalanced, which could sort of indicate why children with ODD act out in hostile behavior. They might misunderstand what people are trying to say to them and then overreact because the message is not delivered as clearly as it should be. ODD is also a comorbid disorder, which means that it's sometimes accompanied with other disorders, such as ADHD, OCD, or anxiety disorder, among others, which makes ODD a much more complicated disorder to deal with. Other causes for ODD are genetic, and this is when children might be predisposed to ODD when family members have mental illness, such as mood, personality, and anxiety disorders. Environmental causes include dysfunctional family life, neglect and abuse, and inconsistent discipline. Strategies for coping with children with ODD, for parents, teachers, and anyone who deals with children who have ODD. The most important aspect of the strategy is to build on positive. Children with ODD receive so much negative attention that oftentimes positive reinforcement and attention is sort of forgotten. And children with ODD have so many demands on them to correct their behavior, and usually people focus so much on what they do wrong that they forget to focus on what the children do right. So the best way to help children with ODD is to focus on the positives and build upon them and try to enforce the child's good behavior with positive reinforcement. Take time out to cool yourself to avoid conflict. That is also incredibly important because this can avoid a lot of arguments. Set up reasonable, clear, consistent expectations and follow through with them. It's important to be consistent because this is exactly what children with ODD require. They need consistency and clear, precise rules that they will understand. Talk about feelings and allow the child to express them freely so they could be solved with appropriate strategies. Anger management is important to regulate anger. Ignore certain behaviors and focus on the ones that need to be changed, which ties into the building on the positives. Try to avoid the negatives and focus on what is easier to change right now. Change that first, then keep going on to the next behaviors. Structure and consistency are important. Once again, children with ODD really need consistency and structure, and they will thrive when they receive it. Treatment options include anger control training, problem-solving skills, learning how to express feelings and manage them, learning to make good decisions based on thinking, manage outbursts by setting clear rules and consistent expectations, and proactive parenting techniques, which are also very important. If parents are sort of proactive beforehand, they take time to think through what they will tell their children and how they will parent them, children with ODD will thrive much more. This was a presentation on ODD, or Oppositional Defiant Disorder. For further references, you can visit the following links and learn more about this disorder so that you could be more informed, and perhaps when you meet a child with ODD, you will understand them better and try to help them instead of feel as though they're being difficult. Thank you.